is an uncontrollable risk factor, you can still do something about it. And you might think, well, you just said the words uncontrollable. Yeah, there's some things we can do nothing about, but just because it's in our family, it's in our surroundings, doesn't mean that we ourselves have to express those genes. And that's the point that is the most important, is that even if it looks like you've got all the cards stacked against you, if you choose to be proactive right here, right now, to make changes, your risks will at least be minimized to a degree. There's no doubt about it. So what are the things that we're going to talk about? So we've got, if you've got a family member that has had Alzheimer's disease, that puts you at an increased risk, and we'll talk about that. If you're female, so we've got one person in the audience that's going, okay, and again, men still get Alzheimer's disease all day, every day. Men get the disease. Unfortunately, women get it at a higher propensity, so we have an increased risk. There's a gene that all of us have in our body, and it's called ApoE. And the ApoE gene, again, helps our body metabolize fats effectively. Fats are really, really important to brain function, to nerve function, to cellular function. But if you have a defect in that ApoE gene, and they call that the ApoE4 allele, then there's a hiccup in the way the brain processes fats. So if you have the ApoE4 gene allele or gene SNP, that also increases your risk. Again, it doesn't mean you're going to get it. It just means if you have that gene, it's going to increase your risk. If you have type 2 diabetes and do not have it well controlled, that's an increased risk. If you have cardiovascular disease, so high blood pressure, high cholesterol, and you're not controlling that effectively, that puts you at an increased risk. If you've had a previous brain injury, that puts you at an increased risk. And if you've had chronic exposure to molds and toxins, those are other things that increase your risk. And we're going to talk about these in more detail